What's hiding underneath things can be scary. Underwater, under your bed, especially what's under your carpet. Except when you get new carpet from Carpet One Floor and Home. After tearing up your old carpet, they'll vacuum and apply Health Annex antimicrobial to your subfloor, disinfecting and killing mold, mildew, and any remaining general awfulness. Carpet One Floor and Home goes the extra mile to protect you, your family, and your home. Carpet One Floor and Home in Columbia, making your home beautiful, guaranteed.
Good morning and welcome to Radio Friends on Tuesday, September the 5th, day after Labor Day. Good to have you here. I want to introduce you to an old friend of mine, Heather Harlan from the Columbia Boone County Public Health and Human Services.
Good morning, Paul.
Good morning to you. I didn't mean you were old. I meant that we've known each other
for a long time.
Right.
Yes,
Okay.
That's right.
So
Happy
what do we
September.
got going today?
Well, we've got, you may recall that September, I can't believe we're already in September, but September's Recovery Month. And that's a time that we pause to remember that prevention is effective, treatment works, and people can and do recover from substance use disorders, or what we used to call addictions.
How many people, Heather, are affected by substance abuse or addiction?
I just read, actually this morning, a study from Kaiser Family Foundation that 2/3 of Americans say either they believe they have a substance use disorder or addiction, or that they have a family member who does.
Two-thirds?
Two-thirds. Imagine the impact on the mental health and financial status of people who are dealing with that themselves or in their families.
Now,
Yeah.
when you talk about an addiction, this can be an alcohol addiction also?
Alcohol, tobacco, and other drugs. And what we want people to know, again, is how they can help. And right now, because of, I'm going to explain more again about what fentanyl is, but I want people to know, because people may not be able to listen to the whole show, about two events coming up. That part of what I do at the health department is facilitate the Boone County Overdose Response Coalition. And there are two events we really want the community to know about. One is that the Compass Health is leading up, is going to be on Tuesday, September 12th, 5:30 to 8:30 at the Crossing. And that will be at the Crossing, that's 3615 Southland Drive.
And what will happen there?
They're going to have a speaker, and they'll have a movie. They also, one of the things we really want to encourage parents to know is they're going to have a physical mock-up of a teen bedroom. And included in that will be 70 clues to high-risk behavior, including alcohol, tobacco, and other drugs, to have parents walk through to help educate them on what to look for.
So they're going to have a mock-up of a teen's bedroom?
Yes, to walk through.
And what are some of the things that parents would look for?
One of the things that I had noticed when I had viewed part of this information, for example, was that they may have, in another version I had seen, was maybe some tennis balls.
Tennis balls.
Why would that be a concern? Well, you can cut those open and put drugs in them, Paul. So I wouldn't think of this. And sometimes there are hats with a lot of different pockets where they might hide pills. So some things to look for: crushed up can. Sometimes people use cans to smoke drugs. So we want to have the parents aware of that. And that event at the Crossing is really going to help out. My colleague Dave and I will also be there distributing naloxone or Narcan that can help reverse an opioid overdose. And I'll talk more about that in a minute. So the second event, and again, these are both open to the community, no cost, no registration.
Okay.
The second will be a Save a Life event. The coalition has those once a month, and it will be from 5:30 to 6:30. And that's more of a training event where we will take a lot more time to show people how to use naloxone, how to feel confident and comfortable using that, and recognize the signs of an overdose.
Okay, so what is naloxone?
Well, I can show you here. It's a nasal spray, and fentanyl is an opioid that's finding its way. It has legitimate medical uses, but it's finding its way as a street drug now into everything. Fentanyl.
Okay,
yes.
What is fentanyl used for?
It's a painkiller. So when high levels of pain, but anything that addresses pain, especially quickly, has an addictive quality to it. And so fentanyl is what, when we hear about the pill mills, et cetera, some years back, that was what was happening, was that there were too many of these being prescribed. So then guidelines became in place and people couldn't get them, even though they had been following their doctor's orders. So we have a higher level of people who are dealing with an opioid use disorder or addiction.
So how do you know if a painkiller that you have been prescribed has fentanyl in it?
I would talk to your pharmacist and your doctor about that. That's the best way to know. But what we want to look at then is how we help people recognize an overdose out in the community.
And how are these people in the community getting their hands on fentanyl?
Well, fentanyl, it's coming in mostly from Mexico now and mixed in with all other drugs. It's very cheap. It's easy to transport. It's white, goes with anything. So people may think they're buying meth, for example, or maybe some recreational cocaine. All kinds of drugs now, including vape pens and THC products in our county, all kinds have detected fentanyl in them. And it only takes a few grains to be a fatal overdose. So that's why we want to educate people about Narcan. And I wanted to show your viewers here what that looks like. So when we give you a box, you will get 2 of these.
Okay, they look like little, for
Yeah,
people
they
listening on
are.
the radio, they look like little nasal sprays.
Right, little nasal sprays. And those of you you can see it's, and you insert this in the nostril of an individual. They're not breathing. They may be turning blue or ashen if they're a person of color.
So how do you know if someone is having an overdose due to fentanyl?
Their breathing is affected. They suffocate. That is the main cause of death from that. So people may be not breathing. They may be blue in color because they're not breathing. If it's an African American, they may be ashen in color. You're unable to get a response for them. So we want people to know that you can carry naloxone and be able to revive someone, that you insert the nasal spray in one nostril and you squirt it. Then you wait 2 minutes, which is a really long time, and then you squirt it in the other nostril. So the most important thing is also to call 911. Whether you have naloxone or not, call 911, and it won't, if it's not an overdose, it will not hurt them if it's from some other cause.
Okay, so if you see someone and you suspect that they have an overdose of fentanyl, and you said if it's not fentanyl and you give them, it's not going to hurt them.
It will not hurt them, no. So that's why we want people to feel confident and comfortable to be able to do this. I just recently, a while back, heard of a man on a flight that had Narcan with him that was able to save a life on an airplane of someone who had taken, I think, a pill that they thought was a legitimate painkiller, and it was a counterfeit pill and could have died.
Oh.
So for us to be able to carry this,
So
yes.
you're going to be giving these out to
Yes,
people?
at both of those events, on
Okay.
the 12th and on the 26th. Yes.
Okay. For more information, we're out of time, Heather, but
Yes.
if you go to the Columbia Boone County Public Health and Human Services website, you'll have all the information.
Absolutely. Thanks so much,
Thank you
Paul.
so
We
much,
appreciate
Heather
it for
Harlan,
helping out the
coming by.
community. Thank
Okay.
you.
All right.
Bye.
Drop me an email, pepperpmissouri.edu. Bye-bye.